Learn more. Tuberculosis. Presented by Maine Center for Disease Control and Prevention. Infectious Disease Epidemiology Surveillance Program. What is tuberculosis? You will sometimes see tuberculosis abbreviated as TB. Tuberculosis is caused by a bacterium or a germ. TB usually affects the lungs, but sometimes affects other parts of the body, such as the brain, kidneys, or spine. Tuberculosis is spread through the air from one person to another. Germs from a person infected with active tuberculosis are put into the air when they cough, speak, or sing. The germs can stay in the air for several hours. Tuberculosis germs are more likely to be spread in indoor areas or areas with poor air circulation. There are two types of tuberculosis and they have important differences. The first type is called active tuberculosis. This occurs when your body cannot stop tuberculosis germs from growing or multiplying. Someone with active TB of the lungs feels sick and shows symptoms of being sick. These symptoms can include a cough lasting 3 weeks or longer, chest pain, coughing up blood or phlegm called sputum, fatigue, weight loss, loss of appetite, chills, fever, or night sweats. Tuberculosis can affect other parts of the body too, and the symptoms may be different. It's possible for someone with active tuberculosis of the lungs to spread tuberculosis to others. If you have active TB, it is important that you contact a healthcare provider to seek treatment. The second type is called inactive tuberculosis. This is when tuberculosis germs live in your body without making you sick. Your immune system is properly fighting off the germs. People with inactive TB do not feel sick and do not show symptoms. People with inactive tuberculosis cannot spread tuberculosis to others, but should still contact a healthcare provider for appropriate treatment. Treatment. Active tuberculosis can be treated with medicine. It is important to complete all medications as directed by your healthcare provider. If you do not, this may make the TB bacteria in your body resistant to the medication and harder to treat in the future. If you have active TB, you may receive treatment support called directly observed therapy. This is when a healthcare worker assists with medication administration or medication reminders, either in person or virtually. Directly observed therapy is strongly recommended for people with active TB. Inactive tuberculosis can also be treated. This is to ensure that the germs in your body do not become active and make you sick. Do you still have questions about tuberculosis? Contact Maine CDC by telephone at 1-800-821-5821.